This presentation was done by occupational therapy students Ashley T., Buna, and Sean. The purpose of this presentation is to provide greater detail on the template provided about developmental coordination disorder, or DCD. In this presentation, we will discuss various aspects such as what it is, the diagnostic criteria, the risk factors, some signs and symptoms, some comorbidities, precautions and contraindications, treatment, occupations that are affected by this disorder, and OT's role in the treatment. We will start our presentation by discussing what DCD is. It is a lifelong developmental disorder that is marked by clumsiness in otherwise healthy children. It makes it hard to learn motor skills and coordination. DCD is not a learning disability, however, it can impact learning. These children are known as the clumsy children or physically awkward. The typical onset is early age children around 5 years old and persistent into adolescence or adulthood. Children with DCD are more likely to develop poor self-esteem, academic problems, behavioral problems, difficulty with peer relationships, and difficulty with social competence. According to the DSM-5, impaired motor coordination is the hallmark feature of DCD. To give a diagnosis, 4 of the following must be met. Performance in daily activities that require motor coordination is substantially below that expected given the person's chronological age and measured intelligence. Marked delays in achieving gross and fine motor milestones. For example, poor handwriting, poor performance in sports, dropping things, or overall clumsiness. The deficits significantly and continuously interfere with academic achievement or activities of daily living appropriate to their chronological age. Onset of symptoms is in the early developmental period. Motor skill deficits are not explained by intellectual disability or visual impairment and are not attributable to a neurological condition affecting movement, such as cerebral palsy or muscular dystrophy. If intellectual disability is present, the motor difficulties are greater than those expected for the mental age. Risk factors for DCD include being small for gestational age, being born premature or with low birth weight, genetics or a history of developmental coordination disorder in the family, prenatal exposure to alcohol or drugs, neurological dysfunction, and it is also more common in males. The etiology is genetic and environmental. Examples of signs and symptoms at specific ages. During preschool age, they have trouble holding and using utensils, trouble throwing a ball, they may play too roughly or often bump into other kids, and have difficulty sitting upright or still. In grades K through 2, they have trouble holding and using a crayon, pencil, or scissors, they don't form or space letters correctly, struggle with going up and down stairs, frequently bump into people by accident, and have trouble with self-care like brushing their teeth. Grades 3 through 7, they take a long time to write, trouble cutting food, difficulty with basic routines like getting dressed, struggle to line up columns when doing math problems. Teens and adolescents avoids or struggles with typing and texting, struggles with visual spatial aspects of math, struggles with opening latch on locker, difficulty learning to drive. Cognitive and behavioral delays may become more apparent as a child ages due to frustration with poor motor skills, low self-esteem, and social isolation.
Once a week, kids from all over North Texas meet to play at the Little Mavs Movement Academy. As they write their name in the air with ribbon or slither around an obstacle course, they're actually working on improving their handwriting, balance, and motor skills. But when you're a kid, this is just fun.
This is sometimes like the highlight of my week. It's the most, I look forward to come here after school.
10-year-old Quentin Thomas has been playing here since he was diagnosed with developmental coordination disorder.
We are really concerned. What is he not going to be able to do? What is it going to hold him back from?
DCD is surprisingly common, impacting roughly one child in every classroom. The motor skills disorder makes tasks like tying shoelaces, buttoning shirts, and writing clearly a challenge.
Other than that, they're very intelligent.
Assistant Professor Dr. Priscilla Casola oversees the free program at UTA.
Every time you talk about DCD, parents know that their kids have this condition.
This is Eli. This describes Eli to a T.
When Eli was referred here by his school principal, he was struggling with a rite of passage, riding a bike.
It helps our arm twist and turn if you already know how to ride a bike.
Dr. Casola says because kids are otherwise bright, symptoms can be dismissed as laziness. If not addressed, the disorder can impact them in and out of the classroom.
They are at risk for bullying, for anxiety, depression.
The program focuses on preventing that in a place where kids get each other.
I feel like it's good to know that they're not the only ones.
For Eli, time at the Little Mavs Academy led to this victorious moment.
I can actually ride my bike without training wheels.
That's awesome.
Quentin, who used to dread team sports, has been playing on a basketball team for several seasons and no longer feels frustrated when he puts pen to paper.
Well, my high end running used to be like right here, and then it got to improve to like right there.
General medical conditions associated with developmental coordination disorder include ADHD, which is the most common co-occurring condition, specific language impairments, language-based or nonverbal learning disabilities, anxiety, and autism. Precautions and contraindications to be aware of. Precautions. Patients with developmental coordination disorder are at risk for falls due to decreased balance and postural control. Make sure to follow protocols for fall prevention. Ensure that the patient and the family or the caregivers are aware of the potential for falls and are educated about fall prevention strategies. Keep a clear space free of hazards while the client is engaging in a motor activity. Ensure that tools, utensils, or scissors are not dangerous to a client who has a deficit with hand coordination. A contraindication to keep in mind. Do not provide a high-pressure activity to a client who suffers from anxiety along with DCD. General medical course of treatment. The collaborative team would consist of teachers, special ed teachers, primary care physicians, neurologists, occupational therapists, physical therapists, speech-language pathologists, psychologists, and social workers. The setting. Therapy can occur in the home setting, school setting, or clinic setting once the diagnosis has been made. The client may have been referred to doctors, psychologists, neurologists, and specialists prior to diagnosis at an inpatient or an outpatient facility. Common medications associated with DCD. There are no specific medications associated with this disorder. However, a child may be on a medication due to a comorbid disorder, such as anti-anxiety medication for the treatment of anxiety. Also, methylphenidate improves fine motor performance in children with DCD and ADHD. There are many areas of occupation that DCD can affect. Here are some examples. Activities of daily living, such as dressing, functional mobility, personal hygiene and grooming, and feeding, can be due to reduced participation in self-care. Education can be affected when there is reduced participation in academic activities and affected school performance. Leisure and play. When a client has trouble maintaining balance and coordination, results in avoidance of participation in leisure and physical activities. Social participation. When a client tends to avoid engaging in activities, has difficulty with peer relations, and experiences social isolation. Activities of daily living tend to be the most important factor to focus on during treatment.
The occupational therapist plays an integral role in treating children with DCD. OTs conduct screenings, assessments, and consultations with teachers and parents in order to provide the best treatment possible for their children. When treating children, OTs tend to strategize depending on the child's specific weaknesses. But some very common tasks that OTs tend to work with children on include handwriting, cutting with scissors, and tying shoes. Each of these examples is a common ADL in the world of a child. One common technique an occupational therapist may use to encourage gross motor activity in children is play. Play encourages children to strengthen muscles and provide sensory input that may enhance motor and praxis skills. Play is both a motivating and natural technique for a child to practice. task-oriented, and perceptual motor interventions that focus on specific practice of skills have been shown to be helpful. These strategies can improve coordination, successful pursuit of occupations, and quality of life. When working with a child with DCD, an occupational therapist must work on improving their motor functioning, adapting the environment to better suit their needs, and utilizing modified equipment. When improving the child's motor functioning, it is important to focus on both fine and gross motor skills. Some examples of fine motor skills include cutting with scissors and writing with pencils, pens, or crayons. Gross motor skills include walking without falling or tripping and general hand-eye coordination, such as playing baseball. When adapting the environment, it is important to make safety adaptations for the child, such as putting down cushions, carpets, or pillows to cushion the child's fall, or by improving the lighting inside of the home so that way the child can better avoid trips. Utilizing modified equipment includes examples such as buying the child shoes with better grip and a wider base of support to lessen the chance of falling, and having the child utilize utensils with a larger grip to make eating and other ADLs easier. On this slide, we will introduce different types of adaptive treatment equipment for clients with DCD. Under picture A, you will see loop scissors. Loop scissors are used to help increase control for kids who struggle with coordination or hand strength. Under picture B, you will see dressing boards. These are used to help children practice skills step by step. Kids tend to work with these tools on a table, rather than working with the actual clothing on their body. Under picture C, you will see a lacing board. This lacing board has two different colored laces. This is used to teach each step of the shoe tying process so that children can clearly see how the laces intertwine and the steps required.